maybe they come in for 3 visits because they're like, that's literally all I needed.
Yeah. I've seen it before at a follow-up where it's like, I didn't realize when you gave me that homework that it was going to like change my life.
I've seen it before and I'll say it again.
Hell yeah.
You're listening to the Pelvic Freak Show
with your hosts, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of the Pelvic Freak Show.
Where you're freaks for us and we're freaks for your pelvis, baby.
Why was that so weird?
Because I was looking at myself in the camera and I was like, do I actually look good today?
Hey,
or is it weird?
No, you look cute.
Thanks.
Yeah.
We'll see what the freaks have to say.
Giving Dom mask energy.
Oh, thank you.
Mm-hmm.
Well, guys, today we have decided to start the episode off with a little Would You Rather Pelvic Freak Edition.
Oh, not all of mine are Pelvic Freak Edition.
Okay, well, my idea was to have it Pelvic Freak Edition.
Only 2 of mine are.
2 of Amanda's are.
Well,
that's okay.
Honestly, depends on your definition. We'll see.
Okay. All right. So I'm going to start with my first Would You Rather. Are you ready?
Yeah.
Okay. All right, Amanda. Would you rather have free food delivery service for the rest of your life, but it's only fast food, or have a really good smelling fart, but it smells so good that everyone's constantly asking you to fart for them?
Wait, clarifying question. The food one, can I not eat anything else?
You can eat other things.
I just can't order them for free? I'd rather have that.
You don't want a good smelling fart?
No. I don't want people asking me to fart.
Imagine anytime you fart, it's like if you fart, you don't have to worry about it because it's going to smell really good.
Does that get rid of the sound stigma and all that?
Yeah, because everyone's like, oh shit, it smells good in here. Like it would change the name of the fart game.
But not unless everyone's smart. Fart.
Would a fart noise be funny still if it smelled really good?
Okay, but here's the thing. You're walking down the street. Someone doesn't know your fart smells good, so you fart and it's still embarrassing.
I guess you're right. That's right.
I like the idea of where it wants to go.
Okay, let me change it then. Would you rather have free food delivery service for the rest of your life, but it's only fast food and you can only eat that? Or would you rather everyone love the smell of your farts, they're always silent, but everyone's always asking you to fart for them all the time?
I don't want to be asked to
like
fart.
At the beginning of every conversation.
Oh, no. I don't like I don't want to only eat fast food, so I'd have to do the fart thing.
You'd have to do the fart thing?
I feel like, yeah.
I knew you were a freak.
All right, should I go next?
Go next.
Would you rather pee right now, every pee that you're going to have for your whole life? So like one long pee, long as hell pee. Or would you rather poop every poop you're going to have onto the floor and you have to clean it up?
Wait.
But you never have to pee or poop again after.
Hold on. Okay. Every pee, but then you never have to pee again, or you never have to poop. I kind of like pooping.
I know. I would pee every pee.
So I think I would do the long pee.
Wait, you didn't tell me what you would do for the fart one.
Was I supposed to?
Yeah.
I would want to have good smelling farts for sure.
Yeah, I knew it.
Of course.
You love to fart.
I don't love to fart. It just happens sometimes. And I'm sick of it.
Hannah comes up to me one day. She goes, I think I have a farting problem. And I'm like, oh, did you do it in your sleep again? And she goes, no, just like in general.
Like in general. Like it's just, I think what's happening is I'm just gassy.
I thought that was going to be some like revolutionary thought.
I'm sick of it.
Oh, man.
God, the girls with tummy problems, no. I don't have tummy problems.
No, you've never had diarrhea?
Diarrhea isn't a thing for me. But
diarrhea is a thing for me.
I hate being gassy.
So I considered the poop one.
I lean more gassy bloated. And I'm sick of it. I'm sick and tired of this godforsaken curse.
That's tough.
Good thing I have a pelvic floor PT.
Yeah. Also for the pee one, I would pee all my pees because then traveling would be so much easier.
Yeah, that'd be so nice.
You just walk around for like 12 hours without having to pee.
But then everyone knows every time you go to the bathroom, you're going to be shitting.
That's fine.
It's fine.
They don't have to know.
Yeah, and I don't mind. Like, you guys know pooping does feel good. Right? Sometimes it does.
It does. Unless it's fiery diarrhea.
It's the worst.
Then it hurts.
Yeah, this week I drank spicy margaritas.
Oh.
I got a craving for it, and I made them way too spicy.
Oh, that just happens to me when I do anything, actually.
What do you mean?
Fiery diarrhea.
Okay. Sorry, I'm going to move on.
Okay, next.
Okay, ready?
Yeah.
Would you rather come every time you fart or fart every time you come?
I would rather die.
You have to choose one.
I would come every time I fart. I'd figure it out.
Figure it out, wouldn't you?
I would change my whole diet. I would make sure I'm not farting a lot.
The obvious answer is come every time you fart.
Because I can come silently, but I don't know what's going to happen to a fart if I'm coming. I can't control it.
Yeah. That's so true.
Because I can hold in farts pretty good.
And when you come, that's like sexy. Like, it's like,
yeah.
I don't want to be farting, but if it does, whatever. But
I can hold a fart if I need to hold a fart.
every time?
Every time.
Like, every time you come, you fart.
And then I'll just go somewhere else. Private room, fart it out.
What if we change a little bit? Every time you come, you fart, but you don't fart any other times.
Nope.
Really?
I don't want to fart every time I'm going to have, I'm not going to be able to come anymore.
Ruin it for me. Okay, what's your next one?
Okay. Would you rather be in a room for an hour with every person you've ever kissed or every person your significant other has ever kissed?
Do it again. What was it?
I stole it. Okay, would you rather be in a room for an hour with every person you've ever kissed or every person your significant other has ever kissed?
Every person I've ever kissed.
Because you'd get too jelly?
Yeah, for sure. And also, I'd have some shit to say to them. I will come loaded. And they'd all have to spend an hour with me in the room.
You know what? I would choose the people I kiss too because there's some shitty ones in there, and then they would see how hot the other ones are, and they'd be like, "Damn, she pulls."
Yeah, but then
like,
the hot ones would be like, "Damn, she been with some uggos."
I wouldn't say uggos,
or would have been some weirdos. For me,
I mean, kissing. Yeah, I've kissed frogs.
Yeah,
I've definitely kissed. I'll kiss about anyone that I see.
Who cares what they all think, anyways?
If we're going with slept with, I feel like I have a pretty good pool. Aside from the assholes.
Besides from the assholes. Mm-hmm. Yeah, fair. Well, do you have another would you rather? Because you took my last one.
Yeah, it's not really pelvic floor related.
That's okay.
Would you rather have a private chef or a private chauffeur?
Private chef.
I pick chauffeur.
Really?
My number one fuck you money service that I would have is a driver.
Really?
Yeah, because I get car sick, I want like a black Escalade, like a big car that it smells the right way, that doesn't trigger my like car sickness. And then I just know my driver and they know how to like set it up for me, and my like seasick glasses are in there and everything.
I like that.
That's my vibe.
I mean, I'd be down, but private chef, I'd spend way too much time trying to figure out what I want to eat.
Chef is like third on my list, probably.
What's second?
That's a good question, actually. It might be second.
Damn. What's third?
I feel like I've done a list, though, and it wasn't second. And I can't remember what was second.
Okay.
Personal shopper, maybe. Like someone that's just a stylist. Like all the time.
Yeah.
Doing my stuff. Yeah. Oh, personal assistant.
Oh, that would be
I think
iconic.
that would actually be number one.
Yeah.
So then they can book my drivers for me.
Oh, there you go.
But out of those two, I pick chauffeur.
Okay. Ready?
What?
Gun to your head. Name the 3 American Idol judges right now.
Katy Perry. Is it still what's his face? God, what's his name? Oh, I can't remember the other two. Give me a hint.
Give you a hint? Mm-hmm. Okay, my first hint is it's not Katy Perry.
She's not a judge right now?
No.
Damn. Okay, well then I got it wrong.
Ready? It's Luke Bryan, Carrie Underwood, and Lionel Richie.
Lionel Richie and Luke Bryan have been around for a while.
Yeah.
I couldn't remember them. Carrie Underwood instead of Katy Perry now?
Guess so.
Damn.
Wild.
2 country artists?
Didn't Carrie Underwood win American Idol?
The first season.
It was
Kelly Clarkson. Did Carrie Underwood win American Idol?
I don't know.
I don't get them mixed up as people, but for whatever reason, when it comes to American Idol, I get them mixed up.
Yeah. Those were the simpler days. American Idol, sitting on your couch, texting to vote.
Texting to vote. I was watching it 2 years ago, dude.
For real?
Yeah, I love American Idol.
That's awesome.
It's so fun.
That was a good little
That was a good little bit.
that was a good little start to get you guys warmed up.
Should I have a gun to your head question?
You don't have to. I just honestly wanted to know if you knew the American Idol judges.
Gun to your head. Who are the founding fathers of the United States?
All of them? Aren't there like 30?
Wait, aren't the 4 majors?
There's 4 major ones
The Mount Rushmores.
on Mount Rushmore. I thought Abraham Lincoln was on Mount Rushmore. He's not a founding father, right?
Is he on Mount Rushmore? I don't think so. I don't know the answer to this question.
Aren't there like 30 founding fathers, bro? They all signed to the freaking Constitution.
Dog, Lincoln is... Oh, he is on Rushmore. Who's on Mount Rushmore? Oh, they're presidents. Okay, who are the presidents on Mount Rushmore?
Benjamin Franklin.
Nope.
Okay, ready?
Yeah.
Wait, Benjamin Franklin on Mount Rushmore would be so funny. Hold on. Abraham Lincoln, George Washington,
Okay.
and then there's another one.
Well, there's-
Thomas Jefferson.
Okay.
That's the one. I get Thomas Jefferson and Ben Franklin confused.
That's fair.
And then John Hamilton.
No. And isn't it Alexander?
I think so.
He's a founding father.
Who's John Hamilton? John Hancock. That's who it
John
is.
Hancock is who they, but that's not the 4th person.
Okay, who's the 4th person?
Theodore Roosevelt.
Theodore Roosevelt. I was going to say Theodore Roosevelt. I was just going to say that. Jesus Christ.
That's actually pretty good.
Yeah.
I don't think I would have gotten 3 out of
For
4.
never having seen Mount Rushmore,
I did see it. I don't know.
what did you think about it?
It was super underwhelming. Crazy Horse was much cooler.
What's that?
It's like the indigenous park. There's like a park that's protected. And there's like a statue that's very significant to the culture.
Nice.
And that's like right by Mount Rushmore. And it's cooler.
Oh, perfect. Mm-hmm. Put it on the list.
Put her on the list if you need to go to South Dakota. Also, before we get into the meat of the episode, Hannah and I wanted to so kindly ask anyone listening to leave us a rating on whatever platform you're on. They help us so much with outreach, and we love hearing from you on your feedback, and we appreciate it.
Yeah, and send us some episode topics that you guys want us to discuss, because the things that we might think of might not be the things that you're thinking of. And the only way we can know is if you tell us.
Yeah, and we do want to touch on topics that are going to be significant for you and give you some good information that you're looking for.
Exactly. So what are we talking about today, Amanda?
We're talking about scar tissue.
Scar tissue.
Blowhard.
We're talking about scar tissue today because this is actually something else that we treat in pelvic floor PT. We sometimes will have people come to us, for example, post C-section and having a lot of sensitivity at their scar. It's hard to wear tight clothes, and maybe they don't even have any other forms of pelvic floor dysfunction. Maybe it's literally just scar sensitivity. That's what we're going to work on. So we figured we bring it up today. Mm-hmm. Yeah. So what is scar tissue, Amanda?
Scar tissue forms in the tissue healing process. So there are 4 phases, and I'm referencing my notes here just so I get everything right. But there's 4 phases of tissue healing. So that first stage, which is what happens immediately. And like, let's just picture like a surgical incision and your body's responding to that trauma. You're going to have hemostasis. So you're going to have blood flow and clotting in the area to kind of help bring in, it helps stop the rush of blood flow so that you can bring in healing factors. And that's when you're going to move into that like inflammation stage. Inflammation lasts a few days, and then you're going to move into proliferation. So proliferation is like the up to like 3 weeks. So when we're seeing people with an incision, we're saying like it's fully closed at 3 weeks. So that's the end of that proliferation stage. This is where like collagen and tissue start forming in the area. And collagen, when it starts remodeling, which is that 4th stage, it doesn't like go in a straight line. So if you think about like the fibers of your muscle, how they are, like if you're thinking of a quad muscle, the fibers are running lengthwise. Collagen will come and kind of do this if you're watching the video. And if you're not watching the video, it's going to like crisscross and form in all directions. So that's just the body forming tissue to heal the area, but it's not actually remodeled to the way like you want it to be. So that's where you're going to get like raised tissue, pink scars, tissue that doesn't like look like your other tissue in the body. And then it can actually take like a year for a scar to actually be in that final form. And that would be the end of that like remodeling stage. So we can make significant impacts on scars within that first year, but we actually can see people with scar tissue like years down the road for how it has affected the body, pulled on tissues in the surrounding area, contributed to pain in other areas of the body. Like I've seen people post mastectomy that have scar tissues up by their chest, and they'll have like pain pulling on the low back. So just to give you an idea of how broad some of those symptoms can spread from a small surgical incision.
Yeah, that's why we always ask about history of surgeries too when we're doing our pelvic floor intake. At least I do. Because even though it's like a surgery some other place that you wouldn't expect to make an impact, it actually really could. That is also why we tell our C-section mamas that even though you're having a C-section, you could still have some pelvic floor dysfunction too. Because a lot of people think that if they are having a C-section, that means they're not going to have any issues postpartum, but then they end up having some like pain with sex or some urinary incontinence or things like that.
This is also your sign if you're listening and you have like a laparoscopic abdominal incision. Like people will get like an appendectomy or like a gallbladder removed or something. This is your sign. Tell your PT or doctor about that if they ask about surgeries, because they might be like trying to figure out if you have scars anywhere that they want to look at because of your other symptoms that you're talking about. So it's something that I think is very easily forgettable, right? Because it's this tiny little incision, but that's why we ask about it.
Oh yeah. So I'm glad you brought that up, Amanda, because we do work. I got my glasses on today. We do work with laparoscopic scars, and even though they're tiny, tiny incisions, they can make a big difference. So some other scars that we work with, C-section scars, which you mentioned. So scars from like an endometriosis surgery, hysterectomy, any other like abdominal surgeries, and then also perineal tears are very common. Although that's not like an abdominal incision, right? You get stitches and you can have some scar tissue you may get stitches and you can have scar tissue impacting the pelvic floor, and we'll have some increased sensitivity at that tear site. So we'll do internal work to kind of like massage and work on that tear. So it'll look a little bit different than it does like on the skin, but it's kind of the same idea in a way.
The other thing is we will work on scars that were not from incisions. So like while an incision is still a trauma to the body, it's a planned trauma, right? So they're cutting in a specific way to minimize scar tissue, and which does not always happen anyway. So everybody reacts differently. But we're also working on scars anywhere in the regions that we just mentioned that were from a deep cut that like scraped through the dermis. You're going to have scar tissue there. So those can also pull the same way a scar from an incision would.
And it's never too late to work on scar tissue massage.
Never.
So we'll tell you guys a little bit about what we do to help with your C-section or your abdominal scar. Let's start with those, like abdominal scars first. So maybe we'll use C-section as an example because it's pretty common, but it applies to any abdominal scar. And then we'll talk about like some perineal tearing and like what we do with that. So first off, have you ever heard from a doctor telling a patient that scar tissue massage won't help with their symptoms? What do you say to that?
I say, no good.
I say, Boo.
I genuinely think it's one of my favorite things to treat because it makes that big of a difference.
Dude, I tell people all the time, I'm like, you're in luck, senorita, because I love treating scars.
You're in luck, mamacita.
Yeah, literally.
Oh, man.
Yeah, so it really does help, and it's never too late to work on a scar because first off, let's say we're starting with like bare bones. The scar is super, super hypersensitive and it hurts to even touch it. So phase one, I would say, would be if a patient's coming in, maybe it's like immediate 6 weeks postpartum visit for a C-section scar or after their surgery or whatever it was, then I would start off with taking like a towel or different textures, like different blanket textures, and just like rubbing the scar and touching it against different textures. You can do like leggings, yoga pants, t-shirts, like a rougher blanket, like all different kinds of stuff.
What is that working on?
It's working on desensitization. So then
I would say desensitization and resensitization.
there we go. Yeah.
And desensitization, what I'm like focusing on more with like a fresh incision, what they really don't tell you when you go in for surgery is like how long you can have numbness in the area where your surgical incision is. So up to even 6 months post-operatively, patients can experience numbness, tingling, pins and needles sensation around their incision because that's your body rebuilding neural pathways from tissue that was cut. So a lot of people come in at their like 6 weeks postpartum and they're like, I'm still weary about touching this area because it's either too sensitive or it's still numb. So with the technique Hannah's describing, it can be used either way. So if someone is really tender there and they're worried about touching it because they have a lot of pain, that can just help provide gentle stimulus. I've had patients come in, have not touched their incisions, and then after 2 sessions, they're like, now I can touch it and like start to do self-massage just because of that light work that we did. So it can definitely desensitize in that way and then resensitize to help progress neural pathways building. You're just providing a stimulus in that area. So it's basically like training the muscles, but you're training the nerves. So you're training them to be able to feel again and they'll like know where they want to form then.
Yeah. And I'll have people do this at home for like a home exercise program, like nightly typically, because the more often you do it, the better. Let's go to let's progress a little bit. Once we're getting a little bit more comfortable touching the scar, then I'll generally start with like some type of like circle technique above and below maybe. A lot of times like we tell people this before and we've talked about this before, but the C-section you'll have more tenderness above the scar too. So we'll do like light clockwise and counterclockwise circles above the scar, below it, and if it is tolerable, you can go directly onto the scar. And I usually do that both with like a cocoa butter or like cream and without. So I'll start without it to get some like pooling on the skin, and then I'll put a cocoa butter on or something. Any kind of cream is going to work, really. You can even use if you were pregnant and you use some type of like vitamin E oil or something, you could use that. What do you typically tell people?
For creams? Yeah, pretty much.
I have this like link to like a C-section cream that I have people get. And it's like an herbal balm. And I've had some people really like that. If you guys are wondering what it is, let me know.
We used to have one at the clinic that was like clean ingredients. Yeah. And I would just like recommend something like that to them. So I would have them look at the ingredients, whatever, but it was all like safe to be used like near a previous incision. We typically don't recommend creams until like it's closed anyway. So like really you can use anything. But what a lot of people do, which is highly recommended, is using like the silicone scar strips.
Yeah.
So then they need specific creams that don't make them like too slippery that the strip can go on.
Yeah.
So it's really like body dependent.
Yeah. Some people get like some discomfort from the silicone strips. They'll get like some irritation. So I tell people to do how I tell people to wear it. I tell them wear the scar strip during the day and then take it off at night and then do your scar tissue massage at night with your cream or oil. Let it breathe at night and then put the strip back on in the morning. Make sure like all the cream is gone. And usually that helps with any of like the silicone irritation that they get. And I've come up with that method and I feel like it's been working well. Because like I used to have people just wear the silicone strips for however long that the strips tell you can wear. I feel like you can literally reuse them for days,
Yeah.
But it just like, I feel like the scar needs to breathe sometimes.
Yeah.
And using like, that's a good reminder for like your time to do your scar tissue massage.
Yeah. If
Tink,
there's
tink.
like a routine with it or it bothers you, there's definitely like other ways to do it. Like you don't need to use the strip. But what's the purpose of them is it's going to help the scar reach its final form in a smoother way. So it helps like keep the area moisturized too. And they have studies that support the use of strips to get the scar more neutrally flush with the skin over time. So that's like why they recommend them. But yeah, the strips themselves will have different timelines on them. So it's really just dependent on the patient. So like as long as you're using them for some part of the day, it should be good.
Yeah. Yeah. I like the strips, and I feel like it helps. It helps to like, if you're really uncomfortable with touching your scar, even just like that act of like putting something on it, taking it off like every day can be helpful to get you more comfortable around your scar, because for a lot of people, it is really hard to like accept this new scar. So it helps like with some like exposure therapy in a way, I would say. But then we also will work on your scar in the clinic as well. And once your scar is like, next phase of like scar tissue massage, I'll probably start to be like a little bit more aggressive with it. I'll start like bending the scar, doing some like skin rolling on the scar, twisting it, doing like some harder circles both directions. You really can do anything you want.
That's the beauty of tissue that heals in a dysregulated pattern, is that you can literally go like any direction with it. So they actually research recommends.
I love when you do that.
I know, like it's recommended to move in different directions so that you actually are hitting the tissue from those angles. So if you're at a pelvic floor therapist and you're like, this doesn't seem like a massage I normally get, it shouldn't. We are trying to like basically realign some of that tissue a little bit faster. So it looks like it's a little more all over the place.
Yeah. And then once it's become a little bit less sensitive, we'll use some other more aggressive techniques.
Like
cupping or fascial needling to really get in there, get into the nitty gritty of it.
The nitty gritty. I love fascial needling.
Yeah, fascial needling's cool. We learned that in the myopain seminars class, and I use it a lot. It is a little stingy and uncomfortable, so I don't like to introduce it right away. But eventually, if you have some type of like pesky scar and you can feel that scar tissue when you touch it, try some needling, because it could really help break down some of that deeper, thick scar tissue that's causing some problems. And what we do is just tap the needle in and twist it up, and it grabs onto that fascia and like pulls on that fascia. Then we like let it sit, and then we'll keep twisting those needles up. And you can literally keep going as long as you want by twisting them up, but it is a little bit uncomfortable when you twist them, so it's up to the patient's tolerance, but super helpful technique that a lot of people will come in for.
Yeah, fascial needle is different from a regular dry needle because it's not made for pistoning. So it has like little perforated edges on it that get the tissue wound up in it. And if you twist it clockwise, you will not be able to pull that needle out. It'll get stuck in that tissue. And then if you let it sit for like 3-4 minutes, it can just come out easily. So that's how you know it has like unwound the tissue. But at that point, that's when you can like do another round of twisting too. So that's what we're describing.
The more you know. And then the cupping, I use lighter cups. I don't do like fire cupping or anything like that. I do like lighter cups for the abdomen, like the silicone cups that you can squeeze and it lifts up, and you can kind of move the cups around on the scar. You can move above and below. You can let one big cup sit above the scar where people have a lot of that sensitivity. And that's pretty helpful too. It brings blood flow to the area, and it helps like lift the fascia up in a way rather than like pushing it down. So I like that contrast as well. I think it's super helpful. So yeah, there's literally you're not gonna like hurt the scar as long as it's fully healed, it's closed. You can really like work into it just up to your tolerance with your sensitivity, and the less sensitive it becomes over time, then the more you can work it out. Yep. Do you find that scar tissue massage helps with like the C-section shelf that people report all the time?
It's a tricky one because I don't think it hurts in any way, but I don't know that we have I don't know if we have a paper or anything that tells us that it actually helps more than a natural healing timeline, right?
Yeah.
Usually we're seeing C-section scars. If someone comes in and one of their chief complaints is the shelf that they have, they're usually pretty early on post C-section.
Yep.
So then it's like the body's doing its own thing. I rarely see people after the year mark that come in just to want to work on that. Because usually it either resolves itself or your body's just in its form, and that's something that's been accepted as well. But I definitely don't think it hurts.
I would say the same thing. Yeah, I usually start scar tissue massage probably around 8 to 12 weeks typically. So if someone's coming at me freshly postpartum around like 6-week mark, I'll definitely, you just want to take a look at the scar, make sure it's still healing well and it's closed before you start any like aggressive scar tissue techniques. So then maybe I'll start with like the above and below first. And then once it's looking good, then we'll go in with like the harder techniques that we talked about. But
I had one more follow-up thought on the like C-section shelf comment.
yeah.
What I do notice in those patients a lot is the below massage is always really tense, right? So they have like that, it's a little more rigid. So you feel like there's a little bit more rigidity below the scar. And I find that their pelvic floors are way tighter.
Yeah.
So maybe the tissue just needs a little loosening up underneath the scar too, so that you have that like fluidity in the abdomen to contract, relax, move like more as a unit rather than like above scar, below scar tissue, right? So that's also something that like we'll work on with those patients. So it may or may not make a difference for the actual like visual appearance of the shelf. Not sure.
Yeah. No, 100%. And I like what you said below, like the tissue needs loosening up. That's why we do diaphragmatic breathing too. Let's say like, even if you're not having any like pain with sex or anything like that, I think of the diaphragmatic breathing as like stretching the scar from the inside. So when you're really thinking like inhaling into the lower belly, you're mobilizing that fascia still, even though it's like lighter, but still something. And then we'll use exercises too. I call it like abdominal mobility, but like cat cows, like a little flow into cobra from child's pose to cobra, some like open books, some twisting, some thread the needles, something to just like twist and mobilize the abdomen and the spine.
Yeah, the diaphragmatic breathing mention is great because when people have an injury or a scar, the tendency is to be protective of that area. So that usually involves like closing in, not expanding the tissue. But really, we want to like breathe into it as much as we can. So I think the reminder, even if someone has been in pelvic floor PT throughout their whole pregnancy, coming back postpartum from a C-section, it might be really weird for them to try to breathe diaphragmatically and like expand that area. So it's definitely something we emphasize.
Yeah. Breathing is the most important thing you'll ever learn from us. That's what I always tell everyone that comes in.
Yes.
I swear the amount of times that just some of that breathing and awareness training helps people with pelvic floor dysfunction is astronomical. It like maybe they come in for 3 visits because they're like, that's literally all I needed.
Yeah. I've seen it before at a follow-up where it's like, I didn't realize when you gave me that homework that it was going to like change my life.
I've seen it before and I'll say it again.
Hell yeah.
But that's our little scar protocol. If you guys have any more questions on it, let us know.
And what Hannah and I were talking about, we use C-sections as an example, but that really applies to any scar tissue. There's just some like pre or like postpartum considerations with a C-section.
Yeah.
But like any surgical incision, we can look at that way too.
Yeah. And then we did say we were going to talk about perineal tears briefly. So perineal tears is very similar scar tissue wise. We'll do our internal treatment. So it's like one gloved finger with lubricant, and we'll probably concentrate it more towards that scar tissue, which is most likely, most commonly a posterior tear. So towards that perineal body. So pretty much like if you're in the vagina going towards your butthole, that's what we're going to work on that scar. Depending on the severity of the tear is how, well, I mean, even small tears can be big differences for some people too, compared to like others. Everyone's different. Everyone's body's different. So depending on the sensitivity from that scar tissue, sometimes people will tear and then not notice anything. So, yeah.
And sometimes people associate a tear with like general painful penetration for the pelvic floor, and it can absolutely contribute to that. but it can be conflated with like tension in that first layer too, right? So it might not be an abnormal sensation if the patient has had painful sex before or had any tension throughout their pregnancy and was needing some releases in that area before. So sometimes it's not differentiable, and then sometimes it feels very new and very different, and it's something we like hyper focus on for a little bit. Burp. Burp word. Why am I doing that today?
I don't know. It's giving sports. Would you rather have a super sensitive and painful scar for a long time, or would you rather have a nice tamed scar that you're used to touching and you can wear tight clothes and you're super comfy around?
I think the second one.
I think the second option.
So come to pelvic floor PT. I said it weird.
Let us know, guys, if you like episodes like this where we kind of just dive into a treatment protocol of something that we see often in the clinic. That's a little bit different content than we've been doing lately, I feel like. So let us know how you like this episode. Feel free to leave a comment. If it's mean, then you can always email us.
If it's mean, then you can always not. Or, send us a private message.
But otherwise, leave us a rating or review if you're a fellow pelvic floor PT. Give us a follow on Instagram too, and then DM us. Let us know how you're treating your scars. We'd like to learn from you as well.
Yeah. If there's any new techniques, research, anything that's been working for you, we'd love to.
And we'll talk about it.
We'll talk about it.
Guys, we're going to do a Pelvic Freak story time very, very soon. And we also want to do a question. Send in your questions and we'll answer format Q&A soon. So be on the lookout. Those 2 episodes are coming up and you'll see all of that on our Instagram feed.
So make sure you're following us at the Pelvic Freak Show.
Yeah, guys, buy a Pelvic Freak tank, buy your merch, support, leave a rating review. We love you guys.
We love you. Bye, Pelvic Freaks.
Bye, Pelvic Freaks.